Okay, before we expose any radiation to our patient, we want to make sure we do our infection control. First, we want to make sure that everything is covered and disinfected, like the x-ray machine, the dental chair, the work area, and the lead apron. Before seating our patient, we want to make sure we have our image receptors, our beam alignment devices, our cotton rolls, our paper towel, and our disposable containers. We want to make sure that we cavity wipe everything, and once everything is completed and nice and clean and disinfected and covered, we will go to the waiting room and get our patient. We will direct our patient to our treatment area, and we'll sit the patient down. And before we start and putting on our gloves, we will adjust the height of the chair, adjust the position of the headrest, and we'll make sure that they're comfortable as possible and tell them like the procedure, letting them know what we're going to be doing today, and explaining to them like how the procedure goes. So once you explain everything to them, you'll put the lead apron on them, so like that. Put the thyroid collar on them, and after that is completed, you want to make sure that your patient doesn't have any like metal objects, for an example, jewelry, glasses, earrings, anything like that. And if they do, you want to let them know that they gotta take it off, because it will ruin the image and you would have to retake it, and you don't want to expose too much radiation to your patient. So after that, before exposing your patient, you want to make sure you wash your hands and put on your gloves and prepare the beam alignment devices. And yeah, just to make sure that your patient knows that everything is clean and your hands are clean. During the exposure, you want to place the receptor inside the patient's mouth, make sure everything is parallel, making sure that they're okay, and letting them know that before you put the receptor in the mouth that it's going to be not comfortable for them, and ask them if they have a gag reflex. And so let them know and instruct them to keep biting down on the bite tab thing, and you'll go over here, take your x-ray, beep, and after that you'll take the receptor out of the mouth, put it on the tray, and take off the lead apron, letting the patient know. Then you'll give them a paper towel just in case they like spit or anything. And then you're all done taking x-rays. And then you wash your hands after, and you direct your patient to let them know the dentist is going to be in. And yeah, you're done with x-rays, and that's how you do an x-ray procedure.